So, Marcin, do you want me to share or do you want?
No, I'll do it. Thank you.
Okay, perfect.
Okay. Okay. Probably I wouldn't call the context a situation, but that's a different thing. I would like to strengthen what my colleagues has just said. We realize that it's just almost a quote from Sophia, that it's sometimes very difficult for a company to cover everything. That's why we really encourage you to talk to one another, to create consortia, and we are more than happy to see a consortium, because we prefer the better solution instead of just somebody who does everything by himself or herself. Of course, that's also the case, but that's just encouragement for you just to talk to one another. You also saw that we have created tools to protect your data and your concepts. That's why if you don't want to share something in public, we understand that and we respect that, and this information will not be published anywhere. It's just for us to understand whether we can work together. And also, we started with the target of decreasing the contamination by percentage, but then we realized that sometimes even removing 90% of something is still not enough. That's why we try to establish this threshold, though that is not easy, because as you just heard, there is not a lot of information about that. Okay, so having said that, can you see my presentation?
Yes.
Okay, good. So let's start. This is the map of Poland. You already saw the map of Europe, and Olsztyn is located in the northeast of Poland. The full Polish name is Wojewódzki Szpital Specjalistyczny w Olsztynie. Please do not try to pronounce that. This is Polish. Polish is the second most difficult language in the world, and that's not just boasting. That's a fact. So if you just say Olsztyn Hospital or WSS, we will know that probably it's about us. Okay, so that's where we are located. You have seen the division of Poland between different provinces, and the hospital covers not only the area that you can see, but sometimes also patients from the neighboring areas come to Olsztyn due, to the fame of the hospital and services that are provided. All right, so that's a brief introduction. I'm not going to go into details. I'm just trying to show you that we are big as far as at least Polish average is concerned. Also, the European language, we are probably twice as big as a average European hospital, bed-wise. We provide inpatient, outpatient services, diagnostic services, and I would like to stress here the diagnostic as being such a big hospital and as the biggest by far. We not only serve the patients that come, but we also provide services for people who are treated in other hospitals. So that's why for instance, the contrast that we have in our wastewater is probably higher than on average. Okay, now let's back to being in Europe. Of course, every hospital is in this project is important. If I was to say why we are important, this is because we represent a relatively big country. I'm not saying we are better, we're simply bigger. We also have the heritage of being under the communist regime. So still there's an influence of what was 30 years ago. Let's say that some mentality sometimes, the way we regulate things. So if we can do business with Poland, you probably can also do business with Czechia, with Latvia, Lithuania. Estonia is already our partner, and we already had a great presentation last time. What applies to Polish at least hospitals, and I also believe that it could be a case of others, that we are limited with the size of the contract that we have. So if our national payer, the National Health Fund, pays us a certain amount of money for treating people, we can treat as many as we can within this budget. So if there's bigger demand for that, so we not always can fulfill all the demand. This also has the influence on other things, which is the fluctuation, let's say, of the use of the water. For instance, during the summer months, we have less patients because we have doctors and nurses and other people on holidays. So then probably there's fewer patients that on average. And also due to the thing I already said, so the contract with the National Health Fund, we can also have relatively smaller amount of patients at the end of the year. So surely this December, most likely November is also a bit influenced. Okay, and now to Karina Rzymowska, with whom we are working on the project. Karina, just tell me where to go next.
Okay, thank you. My name is Karina Rzymowska. I work in WSS in Olsztyn. And I present slide about what we need, what limits us, and what law we must respect. Hospital needs a wastewater treatment plan that will process wastewater to achieve the highest level of purity and safety of the treated water before its reuse. It will reduce the cost of discharging wastewater to the municipal treatment plan, improve the safety and residence of the environment. Next slide, please. We've got limitation. We've got limitation space, localization issues. We've got limitation about treatment plan, operating hours, noise, smell, terrain. The hospital can't accept burdensome condition for the patient and others residents. Next slide, please. The main legal act governing the issuance of permits and decision are Polish Water Law 2017, Act of Collective Water Supply and Collective Wastewater Disposal 2001. Next slide, please. Construction Law 1994, Environment Protection Law 2001, and Waste Act 2012. Next, please, slide. International environment and European Union drives. We've got antimicrobial residence regulation emergency. Urban Wastewater Treatment Directive 2024-2019 and One Health Action Plan against antimicrobial resistance. All this international regulation may in the future affect to quantity and quality of permissible pollutions in Poland. Thank you.
Thank you, Karina. Before we go any further, there was a question in the Q&A section. Jorge Garcia, what Isabella was saying is relevant for the whole consortium. So from when we started again to talk, so the map with the blue map is about specificity of the hospital, but anything that was before that is generally for the whole consortium. All right then. So this is the hospital campus. You can see that it is okay. And one more thing, because Karina mentioned that we have problems with the space within the hospital. We have a saying in Polish that our walls are not built of the gum. So this is not elastic. We just have to stick to what it is, and that is also the case of other hospitals, where there are more and more pieces of equipment, usually the medical equipment, that we have to store within the hospital. So the space in hospital buildings is really something that causes problems. So this is again for most of the hospitals. Okay, so back again. There will be another map in a moment, but here you can see that we are located in maybe not the heart of the town, but in the center. In the picture here, you can see there's a, let's say, strangely shaped building. This is the main building. Then we have a high one, which is also the main building. And there's a part of the main building which you don't see at the moment, which is behind that one. There are other services here. So on the left, there's ambulatory services. In between, there's a dialysis station, and here you have the helipad. Altogether, we were talking about 6 buildings. They are all metered, so we know how much water comes and goes out. We have the internal sewage system, which, let's say, is a separate from the municipal one. Is also we have separate sewage and rainwater systems. We consume that much of water every year, so about more than 50,000 cubic meters. Which goes to 4,500 cubic meters per month. Most of it is used by the main building, which I just showed you. The next, but as you can see, much smaller is the dialysis unit, and then we go even less than that. So that's the hospital. You can see a lot of blocks of flats all around. You can see the street. Okay, you can see some of the streets that are pretty busy all the time, and there are important tracks for Olsztyn communication. So we are, as I said, maybe not in the heart of the town, but within the city center, which also demands, and that's what Karina was talking about, that we must not use solutions that, for instance, stink or are noisy, because there are just people around there. And it also is a case of most of the hospitals in Europe. They were built when, sometimes even if they were built, a bit outside of the city, due to the growth of the cities, now they are within the city, or sometimes even in the center of the city. Okay, so that's the campus. Okay, and that's the map. So I told you that the A is the main building. You can just try to recognize the shape. What is on the bottom is a part that you didn't see. So this is A, and A is not only the biggest user of water, but also it's, let's say, the most diverse. So you can see that there's a lot of different things that are in this water, or wastewater. 8 stories, so quite high. All others are pretty low. And with different kind of wastewater, but this is not as let's say complicated or as in the case of the main building. You can also see the things that are marked in green frames, and these are the things that are related to somehow to healthcare. So on the right-hand side, on the bottom, you can see the provincial center for sanitary inspection. So probably they are not, the users, but I think that they would be interested in learning that such a thing happens, that actually happens, just next door. On the top, there's the dental clinic, so maybe that not much of use of the water, but on the left one, here on the bottom, there's a Szpital Dziecięcy, which stands for Children's Hospital. So that is your probably next customer. If you do something that works in our hospitals, the customer can just walk for, I don't know, 200 meters or 300 meters and see it by themselves. All right. As I mentioned, we have the internal sewage system. I wouldn't say that it's standard, but it's let's say normal, if I can use such a word. So there are pipes, there are chambers, there are everything. What is important, and I'm going to show it in a map just in a moment, we have 4 discharge points to the municipal sewage system, and they are all based on gravity. So you also see on the map later that there's differences in the heights. Hospital is located in one of the highest points in Olsztyn, which also is kind of things to be taken into consideration when we are talking about moving water back and forth. Right. I'm going to show you the map in a moment. It's a bit complicated. There's a lot of details, so let us go one by one so you can have a better understanding and seeing things that are in this picture that shows the internal sewage system. Okay, I know it's a lot, so don't worry, don't panic. First, I'll show you the map that I just showed you. So that is how what you just see. Let me remove this map and turn it so we can have a connection with the last one. So that's what you just seen. That's what we are going to see in a moment. So it's a bit twisted. And now we can go to the final map of that slide. You can see the main building. You can see all other buildings. You can see if something is marked in I would say a bit brown, but I know the colors are always a point of discussion. So that's a bit complicated. Within the hospital, there's also something that's outside the hospital, it's not ours. And in the marked in red, you can see the municipal sewage collectors. And as I just said, we have four of them, almost in every corner, which means that some of the wastewater goes here, some there, but it's all in a more or less short distance. Right. Our specificity or our conditions, we don't have the capacity or knowledge and to run the system and maintain it fully, etc., etc. So this is outsourced to the other company. We of course have somebody who oversees that and checks what's happening, and of course our employees also, go around, do the daily checks. But when it comes to servicing or repairing, we do require somebody to do that. Right. We also have, as I mentioned, the rainwater drainage system. I don't know if it's of the key importance, but just to let you know, if somebody has a solution that, for instance, uses that, this is also something that is to be used. This is also more or less, let's say, the standard thing. It also works on gravity. Here you can see the map of Olsztyn. You can see where this hospital is located. Warmia Mazury, which is the province we are talking about, is sometimes called the green lungs of Poland. It's due to the very unique environment and characteristic. There's a lot of post-glacial lakes. There's a lot of forestry. It's a place where people would go for holidays, for instance, in Poland. And we are, as you can see, in the city center almost. Right. I mentioned it already, but there's something that is more specific to our hospitals, which is this possibility of reuse of water. Instead of, apart from what we just saw and heard, all these requirements, we think that there's a possibility of use the water from the central sterilization station and dialysis unit for a number of reasons. First of all, they are relatively big sources of water. This is not as big as the main building, but you can see pretty substantial. These are located very close one from another. We're talking about 50 meters, so it's very close. And it is not as contaminated as the other water we just talked about. We did some preliminary tests, so this is not something to be treated like a Bible, but we can see that the water that comes from these sources would probably be a bit easier to treat. So please make a use of that as well. Most of hospitals would have central sterilization, and pretty many, and I think in our case it's almost everybody, has the dialysis unit as well. And that's where located. You can see again the main building. You have the central sterilization, the dialysis unit. As you can see, they are very close from one another. And that's it on my side.